let's talk about the path to a lung cancer diagnosis. Now, I know it can seem like a really complex, even intimidating journey. So today, we're going to break it all down step by step to demystify how doctors get from that very first concern to a clear, solid answer.
So it really all kicks off with a question, right? Maybe it's a cough that just won't go away, or maybe you're just worried about your own personal risk. The big question is, how do doctors figure out what's going on? That's exactly what we're going to get into.
Okay, and here's something you really need to know right off the bat. There's no single magical test for this. You can't just do one scan or one blood test that gives a simple yes or no. Instead, think of it more like a careful investigation. A process of gathering clues, looking closer and closer, and then confirming what's really there.
We're going to break this whole journey down into three main parts. First, we'll look at how doctors gather those initial clues. Then, we'll cover how they get to a 100% confirmed diagnosis. And finally, we'll talk about how they figure out the cancer-specific characteristics to plan what to do next.
All right, let's dive right into the beginning. First off, what exactly is lung cancer, and why is this whole testing process so incredibly important?
So what are we actually talking about here? In the simplest terms, lung cancer is what happens when cells in the lungs just start growing completely out of control. As they multiply, they can create a tumor, and sometimes they can even spread. And that's exactly why catching it early and getting an accurate diagnosis is so critical.
Now, another huge piece of the puzzle is that lung cancer isn't just one single thing. One of the main goals of all this testing is to figure out which of the two major types it is. The one you hear about most often is non-small cell lung cancer, or NSCLC. The other type, which is less common but usually spreads faster, is called small cell lung cancer, or SCLC.
So, where does this whole thing kick off? You might be surprised. It all starts with something really simple, just a conversation.
When you first go in, your doctor's main job is to become a bit of a detective. They're going to ask you a ton of questions to really understand your story. Things like, what are your symptoms? How long have you had them? They'll ask about your family history, your personal habits, and if you've ever been around toxins like radon or asbestos.
And then after all that talking comes the physical exam. You know, they'll check your breathing, listen to your heart, that kind of thing. Now, this step alone can't diagnose anything, but it gives the doctor those first essential clues they need to decide what to do next.
Okay, so the conversation's done. The physical exam is over. Now it's time to actually look inside and use some technology to gather more concrete clues.
All right, let's clear something up right now, because this is a big one that a lot of people get wrong. Blood tests by themselves cannot tell you if you have lung cancer. What they can do is give your doctor a really good picture of your overall health.
So a doctor might order what's called a complete blood count, a CBC, which is just a way to get a quick snapshot of your general health. And if they see anything unusual there, they might run blood chemistry tests. These check on your organs like your liver and kidneys to see how well they're working, which can sometimes provide clues about whether a cancer might have spread.
All right, now for the part where we actually get to see what's happening in there. This is where imaging tests come in. A chest X-ray is often the first step. For a much more detailed, almost 3D look, there's a CT scan. MRIs are fantastic for looking at soft tissues. A PET scan is a little different. It looks for chemical activity in your cells, which can really make cancer cells light up. And then a bone scan does exactly what it sounds like. It checks to see if anything is spread to the bones.
So the imaging tests give us some really strong clues, right? We have pictures, but pictures aren't proof. To get the final, definitive answer, doctors have to go from looking at pictures to looking at the actual cells. And this is probably the most important step in this whole journey. I mean it. No matter what any scan shows or suggests, the only way to officially confirm a lung cancer diagnosis is by taking a sample of lung cells and looking at them under a microscope. That's the gold standard.
So how do they get those cells? Well, the most common way is with something called a biopsy. It sounds a little scary, but it's a procedure where a doctor uses a very thin needle to take a tiny piece of tissue. Then, that sample goes off to the lab, where an expert checks it for any cancer cells.
Another way they can get a look inside is with a bronchoscopy. Think of it like sending a tiny camera on an expedition down into your airways. They guide a super thin, flexible tube down there which lets them see everything up close and often lets them take a small tissue sample at the same time.
And the toolkit doesn't stop there. Doctors have a few other clever ways to gather clues. They can check the mucus you cough up. That's called sputum cytology. If there's fluid building up around the lungs, they can test that fluid in a procedure called a thoracentesis. And they can use other types of scopes to see if the cancer is spread to nearby areas, like the lymph nodes.
All right, so let's say the diagnosis is confirmed. The lab tests came back. That's a huge step, but the work's not done. Now we have to answer the next big question. How advanced is it? And that's where staging comes into play. Think of staging like creating a map. It tells your doctors the size of the tumor and exactly where it is, and just as importantly, where it isn't. And this map is absolutely essential for figuring out the best way to move forward with treatment.
For small cell lung cancer, the staging is actually pretty simple. It really boils down to two categories: limited stage, which means the cancer is just in the lungs, and extensive stage, which means it is spread to other parts of the body. But for non-small cell lung cancer, which is the more common type, the map gets a lot more detailed. It's broken down into stages, from 0 to 4. It starts at stage 0, which is very early, with cancer cells just in the lining. Stage 1 means a small tumor has formed. Stage 2 means it's a bit larger or in the nearby lymph nodes. By stage 3, it's in other nearby parts of the chest. And stage 4 means it is spread to more distant places in the body.
Now, as doctors are putting together that treatment plan, there's often one more test they'll run. It's a lung function test. This doesn't diagnose the cancer, but it's super important because it tells them how well your lungs are working overall, which helps them know if surgery is a safe and viable option for you.
And there you have it, from a simple chat in a doctor's office all the way to looking at individual cells under a microscope. That's the path. But here's the most important takeaway. A diagnosis isn't the end of the story. It's not a destination. It's the roadmap. It gives you the clear, concrete information needed to plan the journey ahead. Which leaves us with the real question, doesn't it? What comes next?